Hello, I am Dr. Santosh Kumar, an orthopedic surgeon based in Kolkata, practicing in Kolkata, and I head the Purva International Orthopedic Foundation, a foundation which is determined to bring the world's best in orthopedic surgery right here in Eastern India at most affordable prices. Today we are going to talk about the phenomenon of osteoporosis. Now, osteoporosis is a universal phenomenon. As we age, the bones tend to be softer and weaker. This is known as osteoporosis. Osteoporosis affects equally women and men. It's slightly earlier and faster in women and slightly later in men. Osteoporosis can be primary or secondary. Primary osteoporosis means a senile, age-related osteoporosis, and secondary osteoporosis where there is a definite reason for an accelerated osteoporosis taking place. For example, it can be a medicine use like a steroid use, it can be excessive alcohol use, excessive smoking, or immobility. All these things can lead to secondary osteoporosis. Now, what this primary osteoporosis means? Osteoporosis, to understand this, we have to understand the bony architecture. For example, this is the proximal femur or thigh bone. Now, this bone is composed of hexagonal pattern which is filled up with calcium matrices. This gives strength and durability to the bone. Once this calcium from these matrices start dissolving out, the bones become weaker and the hexagons become empty. This phenomenon is known as osteopenia. Once it advances, this is known as osteoporosis. Now, what are the problems associated with osteoporosis? Osteoporosis leads to generalized bony pain. It makes a person susceptible to osteoporotic fractures. Now, what are these osteoporotic fractures? Osteoporotic fractures are low impact fractures. What it means, a person can just twist his leg and have a fracture. A person can just slip on the ground and have a fracture. There need not be a road traffic accident. Even low impact can cause osteoporotic fractures. Along with fractures of the limbs, that is hands, the neck femur, osteoporotic fractures can affect neck femur, which is almost a dangerous fracture and it is a life-threatening fracture. Along with this, it can affect wrist, it can affect shoulder, and it can affect the spinal bone. When it affects the spinal bone, there is something called wedge compression fractures. Our spine, it's made up of small vertebrae stacked one upon another, and these vertebrae tend to get compressed. This phenomenon is known as wedge compression. This leads to severe back pain and a person tends to stoop forward with this osteoporotic wedge compression fractures. These fractures are treated by kyphoplasty. Kyphoplasty is a procedure where through a needle, a small deflated balloon goes inside the vertebrae, and through an external pressure, this balloon is inflated. This lifts up the compressed vertebrae, creates a space which is filled up with cement, and this gives immediate pain relief and it stops a person from stooping forward. So, we have realized that osteoporosis is a dreaded disease. It's a silent killer which often presents itself directly with fracture without giving any warning. So, we need to treat osteoporosis. To treat osteoporosis, we have to evolve threefold strategy. First is healthy lifestyle. We have to do daily aerobic activity like walking, swimming. We have to decrease smoking or drinking. We have to correct the metabolic parameters which include vitamin D levels, calcium levels, which have to be tested and then corrected accordingly. Along with this, we have certain medicines which includes first, second and third generation bisphosphonate medicines, strontium, calcium, and the revolutionary new medicine which is known as recombinant teriparatide. Now, recombinant teriparatide is given in form of subcutaneous injections once daily for almost 6 months to an year. This is the only medicine which can reverse osteoporosis and drastically decrease the fracture risk. To assess our fracture risk, we have to do what is known as DEXA, dual energy X-ray absorptiometry test. This test can give us T scores based on which we can classify a person to have mild, moderate or high risk of fracture, and based on that we evolve our treatment strategy.